or how do you go about in implementing antibiotics versus herbs? Do you, are you open to using antibiotics? Have you seen success with that? Or do you tend to just go with herbs as much as possible? And if there's anything else that you do to support that?
Sure. So if I was doing this interview 20 years ago with you, you wouldn't recognize what I had to say compared to today because it was very different. And before being aware of CIRS and treating Lyme, I treated Lyme very much like other integrative people treated Lyme. And, sometimes multiple antibiotics over months. Tindamax as a biofilm degrader, a prescription biofilm degrader versus using enzymes. So it was very different. So what I have to say today is based on that experience over time and becoming CIRS literate. There are certainly people in the Lyme world that would disagree with my approach and say it's not aggressive enough. Mm-hmm. But I stand on the fact that it has worked the best. And what we forget sometimes is that when CIRS is present, the person, even if they don't have a lot of gut complaints, if the MSH is low, they already have a predisposition to have gut inflammation, dysbiosis, leaky gut, because MSH is a manager of that terrain. And when it's low, you're going to have some impact. But then you have the majority of people that already have tremendous gut issues. There really isn't anything helpful about antibiotics in those situations, right? So if your approach is a do no harm, which in all of my practice, whether it was primary care, whether it was choosing whether I was going to write a certain pharmaceutical, it was always do no harm. And it was always fully disclosed to the patient what the potential harm was. That's our responsibility. And I think sometimes that goes by the wayside, and we in the integrative world and in the allopathic world, patients are not always as informed as they should be. Yeah. So my approach is actually quite simple, and it's whether it's treating CIRS or supplements and things. I like to bring things down to the lowest common denominator. I like to do one intervention at a time. And it's always been mind-boggling to me when a patient will say, I left someone's office and I had 6 new supplements and I had these 2 prescriptions that I'm to start on. And what I say to myself is, well, how is the clinician ever going to know? Number one, if there's an adverse event, how would you know what caused it? Right. And how will you know what's helping? Mm-hmm. So I use the kind of the analogy of the tortoise and the hare, because I'm definitely the tortoise. I mean, it's one thing at a time. It's please don't take more than one, and let's see what that one thing does. And then we can add another thing. So cat's claw is often a foundational herb just to get a sense of how the patient's going to deal with treatment, because it's kind of global. But if they have say babesia, then on that you would add some anula, which is an herb that from Nutrimetics, which I've worked with that company for, again, 25 years. I've used the Cowden protocol is out of there. I don't necessarily run the Cowden protocol. It's very, very difficult. It's a part-time job for people, and often they just don't have, with the CIRS, they don't have the help to be able to do things 3 times a day and multiple things and changing whatever. So I might add that for bartonella. I might add Houtunia, or Cryptolepis is a good one as an add-on. So we have choices. The treatment can't be overwhelming for the patient. Number one, back in the years ago when I used to see people would see Lyme litter providers, and they'd have these very complex treatment regimens that were incredibly difficult to follow. And in my view, using a slower, more stepped approach got you there without, totally disabling the patient in terms of management.
Mm-hmm.
So, to your question about antibiotics, we are lucky and fortunate to have antibiotics available to us to treat infections so I certainly don't want my stance to look like one that antibiotics should never be used, but they should be used judiciously and thoughtfully. And so if someone, for example, had babesia, now babesia can kill you, probably a lot faster than Lyme can kill you. If you have a babesia infection that turns into pneumonia, and this is, what happens sometimes is people have these underlying infections. They'll go to the hospital with a pneumonia, will be diagnosed. Person doesn't know anything about the fact that they have babesia, and they're treating them with antibiotics, not antimalarials. The patient's going to die because they got the wrong treatment. If you have babesia, you need an antimalarial treatment. If I have somebody who appears toxically ill from their infection, I am not going to mess with herbs.
Yeah.
They are going to get the full boat treatment with antibiotics because that's prudent and important, and it would be foolhardy to do anything short of that. But most of the people I deal with are not that. That's probably happened. I've had some acute anaplasma, very easy to diagnose if you've been, the person is toxically ill. Their liver functions are off the charts. They're very ill. You send them to the hospital. They get a couple doses of doxycycline and some support, and they're a completely different person the next day, and then do the treatment. So there are situations where people need aggressive treatment. And so, yes, to answer your question, I will write them when it's important. And sometimes at the end of an herbal protocol, so sometimes you go in with the herbs, and now maybe the person's getting frustrated. They just want something a little more aggressive. Their gut's in good shape. You can, give them things to stabilize. If the patient says, I really want you to be more aggressive for a month or two, then that's what I'll do. I really try to keep it patient-centered, but always fully appreciate and educate about the downside risks of
right. Yeah, there's always trade-offs with these things, and you learn that really quickly if you're perceptive with CIRS. The whole treatment is a process of gauging trade-offs and then trying to understand, when the benefits are going to be maximized over the downsides. I certainly experienced that now with the herbs that I've been doing, where I was used to at one point just going, hardcore, very intense. Once I got to this point where I think my immune system started to get a little bit better, I realized I started implementing that philosophy of, I'm just going to go really intense, and it backfired horribly.